Good morning, good afternoon, and good evening, social marketers around the world. My name is Win Morgan, and as president of the International Social Marketing Association, it's both my privilege and pleasure to introduce the 22nd in a series of webinars designed to advance social marketing practice, teaching, and research. I'm here today with Nancy Lee and with Jay Kassir, our organizer of the webinar series and chair of the ISMA Membership Committee of our Board of Directors. Now, we'll begin in just a minute, but before we do, I'd like to share some timely updates provided through the International Social Marketing Association. Well, hi there, Jay. How are you?
Well, I'm doing well. Hi, Win. Hi, everyone else. Glad you could join us today.
Hey, I want to make sure that everyone knows that there has been some great activity around the world as far as social marketing associations go. The European Social Marketing Association and International Social Marketing Association, I'm sure you know, have become official affiliates of each other, increasing the family of social marketers around the world. Not only that, but the Pacific Northwest Social Marketing Association in the United States has also formed an alliance with ISMA and other affiliated groups. And the Social Marketing Association of North America has also affiliated with the International Social Marketing Association. That brings together a family of SMANA, Australian Association of Social Marketing, ISMA, ESMA, and PNSMA, all together in a growing movement of social marketers around the world. And if you're a member of just one of those organizations, you also now have free access to the International Social Marketing Association discounts, webinars, job board, and event calendars. So it's great to have you all here as part of our family. And remember, one of the first things that you should be signing up for with that discount, and the discount, by the way, is available on the ISMA website, is the World Social Marketing Conference in 16th and 17th May, Washington, D.C., 2017. Book now because there's going to be a lot of people there. We've just found that we've had more than 200 submissions for papers, posters, and presentations. That's the most we've ever had for a social marketing conference around the world. It's going to be important. It's going to be great. We hope you can be there. And if you want to keep up with events around the world on social marketing, whether you're telling us about events, sharing them, or whether you're looking for something to go to, make sure that you go to our website and look at the ISMA event calendar, which with Jay's help and our other volunteers' help will keep you up to date on what's going on in the world for social marketers. Now I'd like to turn the webinar over to our moderator, Jay Kassir. Jay?
Thank you, Win. And welcome everyone again. I'd like to remind you that if there's more than one of you at your location, we would appreciate if you would let us know how many you are using the chat box on the left-hand side. Also, please ask questions using that text box or chat box as they come to you. Don't wait till the end of Nancy's talk. She'll answer your questions at the end, but in roughly the same order as they come in during the webinar. And there's a number of you, so I expect we'll be getting some questions coming in. I have two polls for you just real quick before we get into Nancy's talk. First, how you found out about this webinar, please. And I see we're still getting responses coming in, mostly from our emails, which is good to see. I'm glad to see the LinkedIn as well as people are coming through that because we put some time into that. Oh, and especially an email from the Pacific Northwest Social Marketing Association, which helped promote the webinar this time. So that's great to see. Thank you. And then our next, another one here, another one from the Pacific Northwest. We'd like to see also where you are from. What part of the world are we reaching today? We had some from Europe yesterday. I think we may be mostly North America today, but let's take a look and see. Some from Central, South America, Caribbean. And pretty well everyone else is North America today. Okay. Thank you. Then it's my pleasure to welcome our speaker for today, Nancy Lee. Nancy is the founder and president of Social Marketing Services, Inc., which has more than 30 years of professional marketing experience in the private, nonprofit, and public sectors. Nancy's co-authored 9 books with Philip Kotler. Many of you will know the Kotler-Lee social marketing textbooks. She is an adjunct faculty member at the University of Washington Evans School of Public Affairs. She conducts seminars and workshops and has had many speaking engagements on social marketing and marketing in the public sector at conferences, coalition meetings, and workshops. She is the president of the Pacific Northwest Social Marketing Association, which she helped co-found. She's a member of the board of directors of the International Social Marketing Association, again a founding board member. She is an inspiration to those who have been touched by her. And if I had to choose 3 social marketers that have influenced me the most, she would be in the top 3. It's my pleasure to present to you once again as a presenter for our ISMA webinar series, Nancy Lee. Nancy, over to you.
Thank you, and I want to start with 3 thank yous. I want to thank you, Wynn, for putting this together and all that you do for the Social Marketing Association. And Jay, you as well, doing all these webinars. I know there's a lot of logistics involved in your time, and then you have to listen to them twice. So thank you for that. The 3rd thank you goes to all of you who are taking the time out to be with us, because I have an ambitious intention for this webinar. It is to inspire you who are on here with us today, to advocate with policymakers to consider social marketing as one approach to citizen behavior change. I'm hoping at the end that you'll see some of the ways that you can, some of the things you can say to them that would make them more likely to consider this. And so that's my whole intention for today. And I'm going to move on here, and I'm going to ask you, I'd like for you for the next 35 minutes, I want you to pretend you're a policymaker. And for the purposes of this presentation, I'm going to define policymakers as not only elected officials, but also government agency directors, program directors at the federal as well as local levels. So I want you to crawl into their seats right now and pretend that you're one of them, and that you're seeing this presentation on how social marketing is a great option, often the highest return on investment for changing citizen behaviors. Citizen behavior change, usually by policymakers, traditionally is done through 2 major strategies. Number 1, information or education. So let's just rely on buckle up to get people to buckle their seatbelts. When not a lot of people or not enough people are doing something, then they say, okay, well, we've got to do more than education. We're going to need a new law, or we need increased regulation, or increased enforcement, or new fines. So then we go to click it or ticket. And there's a 3rd option that I truly want us to inspire policymakers to consider before they go to the law and before they continue putting money into education, and that is the social marketing option. I think it's best explained by this curve that actually started off with the diffusion curve that is used by a lot of marketers and sociologists, but then also now we've turned it into a curve that really represents social marketing experience. So we were just talking about education. So if you go over there onto the left, the group that's going to respond to things like buckle up, we call that the show me group. They think immediately, hey, that's a great idea. I see the value in that. So they just do it. So there's the show me's. Go all the way over there onto the right. That's a group that they do not think that this is an important thing to do. They're not interested at all, and they don't have any intention to do it. And so when that happens, we do need a law or increased fines and enforcement. We call that the make me group. This big group that we're missing so often, the group that doesn't think it's a bad idea, they just have some barriers, or they don't see the real benefit. And that's the group that social marketers, I say, were born for. We were born for the help me group, the group that we will try to understand those barriers, and we will try to knock them down with our tools, and we will try to provide benefit with our tools. So that's the help me group. So here in Washington State, a great market researcher, Nancy Hardwick, at Hardwick Research, helped me do a survey of elected officials so that we could get a sense of their understanding and awareness and usage of social marketing. We had a 3.3% response rate from, we would send it out to state. We think that that's the primary bullseye target audience, our state representatives and senators. And we got 44 states represented back with the 258 responses, 176 from the House and Senate legislators, and also 82 mayors. And what we asked was, when it comes to citizen behavior change, benefiting society as well as the individual, what is their awareness of social marketing? What strategy do they use the most, least, and what would make it more likely that they would use social marketing? So those were our informational objectives. At the very beginning, we asked them if they would describe the term social marketing to someone who asked. How would they describe it? It was an open-ended question, and more than half mentioned the word social media in their response. This was a SurveyMonkey. The 13% actually mentioned something like it's a campaign to change behaviors for greater good. So they got the behavior change component to it. But that's only 13%. We also then defined it, gave them the definition of it, and then asked them now that you know what this one is, which of these do you use most frequently? So 64%, as we suspected, are using education and information campaigns, 31% enforcement, 35% policy, 22% new law, and 20% after this was defined say that they support some kind of a social marketing effort. So 1 in 5 are on our side. What would make it more likely? This was the part that I was most interested in. What would make it more likely you would support a social marketing option? Evidence that it works, a favorite cost-benefit analysis, case studies, and confidence the staff could develop a successful effort. That answer to that question inspired the content of this presentation. So go back and now and be one of the policymakers, and I'm going to be sharing with you how social marketing has been used to improve public health, increase safety, protect the environment, engage communities, enhance financial well-being, and increase academic performance. One at a time, I'll share each one of those and a case example here in the U.S. So the wicked problems that I'm going to be illustrating are ones that policymakers do get confronted with, either by citizens or by their colleagues. Heroin overdoses, property crime, single-occupant vehicles, pets in shelters that are euthanized, homelessness, and college enrollment levels. So let's start off with the improving public health issue. So between 2002 and 2013, heroin-related overdoses deaths have quadrupled. I believe I hear something almost every day regarding heroin overdoses in the news. And so last November, I was listening to Sanjay Gupta on CNN, and he was talking about a success story relative to heroin usage in Massachusetts. And in the city of Massachusetts where this took place, there was a population of 30,000 people. In May, prior to this November show on CNN, there had been the 4th fatal drug overdose, surpassing the prior year's whole total. So not even halfway through the year, and they were surpassing the year before. Well, the sheriff there in that city said he'd had enough. And for the first time, he went to the sheriff's department's Facebook page and posted this. Any addict who walks into the police station with the remainder of their drug equipment or drugs and asks for help will not be charged. I've never arrested a tobacco addict, nor have I ever seen one turned down for help. Looking at the tools that they used in our toolbox, the product that they offered these people that came into the sheriff's department, medical care, detox treatment, Narcan for overdose. The price, all of those services were free, and they reduced a lot of red tape in order for them to have access to those services. The place, they had drugstores they were able to go to for Narcan prescriptions with no prescription required, actually, because they were given that notice from the sheriff department. I love what they branded it. They branded it help, not handcuffs. I would keep wondering whether or not they'd seen that curve, but I doubt it. It's just a natural. It is the thing that social marketers do before we get to the make me approach, or when the make me approach hasn't even been working. We can go to this help me approach. And so they put it on Facebook, and this is just one of the Facebook images where it says close to 100,000 adults and adolescents cannot get the treatment they need, but there is funding enough for their arrest. So they're making the case for help, not handcuffs. In terms of results, 30,000 people liked the Facebook page pretty quickly. It was viewed 2 million times at the time that I looked into this in that November. 3 months later, 145 people had come into the station. And by December, 300 people had, 6 months later, 300 people. And it's now a program in 9 states around the country. So that helped me approach being applied to public safety and public health. So now we'll move on, we'll move on to public safety. So let's take a look at how social marketing could be a solution for public safety. In November of 2014, we here in Washington State got a #1 ranking that none of us really were proud of. It was that we were in the country, the #1 property crime ranking in the country. And the next day at my Rotary Club meeting, the police chief of the city where I live was there, and he stops me and says, "Hey, Nancy, don't you do this thing called social marketing? Isn't that like behavior change? Isn't there something you could do to help us reduce property crime?" And I had said many years ago that I'm here for you, the city of Mercer Island where I live, for volunteer projects, and I'm happy to help if there's anything you need help with in social marketing. So the next day, I went down to the police station and met with a team of about 5 people from the city, a communications person and a detective and the police chief. And we talked about how we would approach this and got pretty quickly to, okay, what's our purpose? It's to reduce home burglaries. And at that time, the city was having about 1.5 a week historically. It's a small town, about 9,000 households. The focus was on actions that residents could take, as opposed to something like increased enforcement. The target audience were the residents of the island. So what I asked was, I said, I would really love to see some data. I'm kind of a data nut. I'd love to see tell me more about these burglaries. When are they happening? And what are they taking? How did they get into the house? And what day of the week is happening? Was anybody home? So they gave me this big pile of wonderful charts and records for the last 5 years. So that's about 80 a year. So I had, close to 400, 500 reports from the police that I could read through. I found it fascinating. And it was everything from, the entry points to the things that were stolen. And I created a little spreadsheet so that I could keep a tally of the date it occurred and the month it occurred, the day of the week, time of day, whether it was on the north end or the middle of the island or the south end of the island, to get more of where is this happening? And I never will forget the moment when I hit the total and I saw that 41% of the entries were through an unlocked door, mostly, and then there were some windows. 80%, there was no one home, and 65% was during the day. This helped us refine our target audience to be those who were usually away during the day or the week and didn't always lock their doors or their windows. Given that, we did a SurveyMonkey, sent it out via nextdoor.com. And Wynn and I have been talking a lot over the last couple of days about how powerful a media strategy this is, because things that are very local can be very personal and very real for people in a neighborhood, kind of let's call it a neighborhood Yahoo group. It's sort of similar to that. So we did a SurveyMonkey, sent it out to the 9,000 households. Actually, there were not 9,000 households on SurveyMonkey. On the Nextdoor, I think it was more like about 4,000. But I wanted to understand what are the reasons, and we got about 800 responses back. And the major reason was that they felt safe. This is a pretty suburban, safe kind of an environment here, people thought, and they didn't think they needed to worry about burglaries. And then the second major reason was that they forget to check. We also asked the question on the survey, so what would make it more likely that you would lock your door and make sure your doors and windows were locked every time you left your home? What would make it more likely? Show me credible data that this is a problem. Share real stories with me, things that have happened to my neighbors that make this much more real for me. Go ahead and help me remember somehow. I said, well, can you help me remember to do it? I could do it. And if you're going to be doing this, and the messenger really should be the police department. They're the ones that I'm going to believe about all this data. It should be the police department. So we took all that advice and created a campaign with the brand Lock It or Lose It by the police department. And we sent out to all 9,000 households, we sent out a door hanger that we, I think, addressed many of the barriers that they had and the motivators that they mentioned. So on one side, it simply says, reminding them to lock it or lose it. And on the other side, it gives some of the data that they probably weren't aware of, that almost half of the burglaries involved in unlocked entry. Most happen in the daytime or weekdays. In occupied houses, 80% more likely to be at targets. And there are 1 to 2 burglaries per week on average. The real fortunate part was that our local newspaper made very visible the realities of these burglaries. So on the left there you see a weekly announcement of a burglary, when there is one, giving the detail, making it much more real that this really happened. In this case, getting in through a window and $3,100 worth of items were stolen. And then they launched the campaign on the front page of the newspaper. Just a second, we'll go back here. I do not have a results slide for you. We are going to be conducting another Survey Monkey this fall to determine the number of people who actually put that hanger on their door and whether or not it's increased their locking the doors. Notice that we're not going to be measuring number of burglaries because we don't have a control group here, so we wouldn't know if that was due to some other kind of a thing. So even if there's a reduction in burglaries or an increase in burglaries, what we're interested in is how many people did this desired behavior that will reduce their risk of burglaries. All right, we'll move on now to protecting the environment. So 76% of us, nation's workers, drive alone to work. This has an impact on the economy in terms of congestion, environment in terms of air quality, and on health because there are better options that would actually improve our health. I really love this case story from Oregon. I don't know if there's anybody on the call from there, but I just applaud this effort. It's one of the most brilliant selections of target audiences that I've been exposed to. They targeted new residents. This is a group that meets many of the requirements of a powerful target audience. They're identifiable. They're probably the most ready for action. Here they are new in a community. They don't know the options for busing and for walking and for carpooling. And they define that as those who have been there within 6 months, and they're able to purchase the names and addresses of new residents from the post office. The behavior they want was to use alternative transportation. So looking at the tools they used at the product level, they were going to be promoting the behaviors of walking, biking, transit, and driving. They branded their walking information kit a 10-toe walking kit, their biking kit the Portland Bicycle Kit, their transit schedules and tracker cards, and their driving info on car sharing and carpooling. These materials, these free little packages of program materials, were free to the resident. The initial postcard there was a postcard that was sent out, and then they could go online to indicate which of those options they were most interested in, or they could send in by mail a little postcard reply that says which ones they were interested in. So we heard you're new to the neighborhood, caught the attention in the mail. My favorite part here, next to the selection of the target audience, was their personal delivery of the kit and the information that the resident said was of most interest to them. Coming out there, of course, walking the talk by coming out on a bicycle. So I thought that was actually really brilliant, too. And then what I really loved is they did a rigorous study to determine their impact here. So they had a control group, in other words, those that were new residents that did not get this intervention. And the group that got this intervention, there were 200 fewer miles per new resident per year, representing a 10% reduction in drive-alone trips. So I'm going to remind you once more, be a policymaker listening to this stuff going, maybe we should try some of this. Next one, engaging communities. So Pet adoption. 2004 to to the present time, the case I'm going to be sharing has been in effect. And the thing that really has always jolted me, being a dog lover, is that 2.7 million dogs and cats are euthanized every year since not adopted. And I've talked to some of the shelter owners and managers, and they've told me it's not because there's something wrong with them. It isn't necessarily because they have any medical disease or any behavior problem. It's because there was probably a lifestyle change for an owner, and that they were abandoned. So these 2.7 million dogs and cats really touched the heart of. I'm going to share later that this is a case for the American Society for the Prevention of Cruelty to Animals. But they understood the barriers to adoption, that people don't know what they're going to get, so they don't go to the shelter. They're not sure of the health of the dog or the behavior of the cat. And they feel like the application is much too difficult to complete, and they don't really know much about adopting a pet. And they actually would really like a purebred, and they don't think they'll find a purebred in a shelter. And I'm just worried you're not going to have the dog that I would want. So the executive director of, I don't know how to say it, ISMA or however, she reminds me of the sheriff in Massachusetts, because basically she's saying the same thing. I've had enough. There's got to be a solution to this. What could we do? They developed a product that I just cannot believe how cool it is. And so the actual product itself is an assessment. I think it's very similar as I read about it, because you fill out a little survey about yourself and what you're looking for in your cat or dog, and then they look at the cats and the dogs in the shelter, and they do observation of them to determine what category they are. The core product is we're looking at the product platform framework. It's saving the pet's life and companion. And then augmented product, extra things that they offered was for the staff to answer the questions. Let me share with you some of this is for the cats. So when you take the survey yourself, they'll classify you relative to how you responded to the kind of cats you wanted. They'll classify you as either a private investigator, a secret admirer, a love bug, an executive, a sidekick, a personal assistant, an MVP, a party animal, or a leader of the band. And so so they will then say to you, well, hey, we've got 10 MVPs right here. You should probably come in and meet them. Come in and meet your match. So there's no fee for the shelters to use this program, and there certainly is no fee for potential adopters to take out the survey. The place, they can either do it, they can take the survey at the facility, or they can also take it online. And the key messages they promote are things like, you could be gazing at the animal of your dreams. The Meet Your Match program wouldn't let you go home without knowing who's in that carrier or on that leash. And this is the only method in existence today that evaluates an animal's behavior and interest and then matches them to an adopter's preferences. I love this. The participating shelters have experienced at the low end 15% and at the high end 60% gains in adoptions. That's a lot of dogs and cats' lives being saved by Meet Your Match. Financial well-being. So let's take a look how social marketing can contribute to that for citizens. In 2015, over 500,000 people are homeless on a given night. This is a report from the U.S. Department of Housing and Urban Development. The annual taxpayer cost per person is $30,000 to $50,000 that actually impacts us for each one of those homeless people for the services and some of the implications of their homelessness. Barriers to going into housing is, first of all, availability. But even after that, there might be some cost required for the individual. But what I learned in looking into this pretty deeply was that many people, especially the chronic homeless, do not enter these places because they require for them not to be using any drugs. So they're not allowed to come in there if they're going to be using drugs. And they also have to sign an agreement in many cases to rehab services and mental health services. The problem is that a lot of the chronic homeless people do not want to give up their drugs, and they do not want to get into rehab services, so they're not taking advantage of some of this housing. Salt Lake City understood those barriers, and they decided that they wanted to do something about this. In 2005, they had 2,000 chronic homeless, not just on any given night, but those that we call the heavy users, those that were there very frequently, homeless. They created a program and branded it Housing First. And what this did was this said that they allowed them to be able to use drugs. They couldn't be a dealer, but they couldn't use drugs. They made sure that they put the person who indicated they would still be using drugs into one of the complexes that didn't have children. They did not have to agree to any of the services, and they kind of understood the irrational, rational behavior model, where it says that, when you're in a hot state, you may not do the things that are really the right things for us, but when you're in a cool state, maybe you're more likely to. So once they're into these housing and shelter, they might be even then more receptive to being approached about help relative to mental services and rehab services. Their goal was to end chronic homelessness. By 2015, they dropped by 91%. So from 2000 to 2005, they went to fewer than 200 in December of 2015. And then if you're just remember back on the very first slide, we're talking about the $30,000 that it could cost taxpayers. Well, Denver and LA are looking at the same kind of a program, and they're finding, and this is the kind of information that can be used to persuade policymakers return on investment, that actually this housing is cheaper than if they stayed homeless. They were able to use some of this information. The last category will be in the category of increasing academic performance. And so 30% of high school grads are not enrolling in college. That's 2015 data. And in Texas, more than 60% were not enrolling in college, many low-income households. Low-income Hispanics. So one of the local school officials had read the book Nudge and got an idea of pairing things and having be opt-out versus opt-in, and tried a new strategy. So the product was that it became a standard for high school graduation to complete a college application, just part of the checklist for when you graduate from high school. And they provided help for them completing the application, and that was provided by a nearby community college staff. The counselor stressed how much money the college grads would earn, more money college grads earned, and they even put it in terms of the audience benefit, meaning how it could help them get a cool car. And the admissions exam was free of charge. The counselors and the exams took place at the high school and really helped them right there at the high school. And then they even had weekend sessions for the parents. In terms of promotion, they went from 2004 to 2005, the percent of San Marcos high school students who went to Texas colleges, not just fill out the apps, but who went to college, rose 11 percentage points. They went from 34% to 45%. And it's been adopted by many other communities in Texas and California and Florida. So I look back over these programs, and I want to look at the things that helped. There were products that helped, like recovery treatment for heroin addicts, Meet Your Match program for adopting dogs and cats, door hangers, and helping fill out college application service. Prices that help, no requirements for being drug-free or agreeing to treatment in order to get housing. Places that help, delivering transportation options directly to homes, weekend information sessions for parents or on college applications, and promotions that helped, social media for the help, not handcuffs, and a lock it or lose it memorable slogan. So now I want you to return to who you are, a fellow social marketer. And I want to plead with you to please help spread the word to your elected officials about the social marketing option and how it's distinct from the education and the law option, and how there often are many, many more in this group, the Help Me group, that we could provide sometimes very simple solutions for, and we would have them, which is much less expensive than a law and much more productive than education. And I would love it also if you would consider doing what we did here in Washington State via the Pacific Northwest Social Marketing Association, where we were able to get permission for and put in an exhibit in the legislative building of our Capitol, so that legislators on their breaks or as they enter into the into their chambers, that they would see these posters and showing people what social marketing is. I'm going to show you some examples of them. We also had an editorial in a legislative newspaper, and we had a radio interview about the exhibit. So here's the Capitol. So if you look up there at the very top, that's the rotunda, and the exhibit was on the bottom circle there on the inside of the Capitol building. And what we did was we showcased 4 success stories here in Washington State for social marketing efforts that used the Help Me approach. We talked about the goals, how it went. We talked about the results. This was one for Labor and Industries. This was one for our Department of Health, related to reducing tobacco use from 22% to 17%. This was on being able to increase pedestrian use of flags by changing the flag. And this was about being able to get people to fix their, often they don't know about, leaks from their vehicles. And that was an award-winning campaign. And then we also, of course, put up this so that they could see the distinction between education, social marketing, and law. And we just found out yesterday that we will be able to put up that exhibit again this next year during the legislative session. It was up for 5 months last year, so that we think that we were able to touch and hopefully inspire many of our policymakers, and we'll be there again next year with 4 more new case stories. So I think I maybe went a couple minutes over, so I'm going to turn it back over to you, Jay, for any questions that you'd like for us to address.
Great. Thank you, Nancy. Well, that was well presented again. This is the second time. We did time 1 yesterday. We do have a question right off the bat from Brian Barasek, and I may expand a little on that. His is, for those of us in the U.S. who would like to see social marketing gain a place of prominence in the White House, just as behavioral economics and nudge have done, what would you recommend we do? So I'm going to add on a tag-along question, which is, do we need to distinguish social marketing from behavioral economics, for example? Is that also important for us to be doing? How would you recommend, if it is, that we do all of that?
Well, first of all, hi, Brian. I'm glad you asked that question. Quite frankly, and to be a little open and honest with everybody on the call, I'm a little concerned that we may lose that office of, I think they call it the Behavior Insight Social, I don't think it's called BIT anymore, Behavior Insight Team. But they have done some good things this year. They do primarily, I was just reading their summary report for 2016. They do a lot of good things. Most of them are, quite frankly, in the behavioral economic strategy toolbox. They do mostly things relative to opt-in, opt-out to change behaviors, as well as improving access, like streamlining application processes and things like that. So I applaud the work that they're doing. And I personally would love to see them expand the tools to include many more of the tools in the social marketing toolbox. They're using primarily the tools that behavior economics use, which they probably don't categorize it as the place strategy, but I do. Maybe some product strategy. I would also like to say that I think that many of us have decided that during the World Social Marketing Conference in May, that we're going to try to organize ahead of time a group of us to actually meet with, assuming that it still exists there, to meet with that team and to share with them some of the other tools and in the toolbox. Maybe, this is probably dreaming, but maybe even to get them to change the name. I think it really is dreaming. And also, I know some of the people on that team, at least via electronic conversations, and we'll invite them to come to the conference, because I think that would be very helpful.
So in terms of distinguishing ourselves from other disciplines like behavioral economics, is that important?
Is it important, did you say?
Is it important to, should we be trying to make policymakers see that we're different, that we have something different to offer? And,
absolutely.
And the best way to do that is what you're describing?
I think that's one of the ways. On a very personal level, too, I am just completing my 10th book for policymakers, and in the very first chapter, social marketing is distinguished from behavioral economics, from nudge, from some of the social science theories, and I position those as mostly frameworks that inspire our strategies. And so that will be available if anybody wants to use the content of that.
Great. And can you talk a little bit, we had a question in yesterday's webinar about the process you use for defining and designing the product and how that may or may not be a collaborative effort. Can you bring us through that again this time?
Okay. Well, for me, product development begins with looking at the barriers that people have to doing the behavior, and that's where we get our inspiration. When someone says that they're in the Help Me group in that they do want to quit smoking, but they've tried before and they weren't able to make it happen, then we say, oh, well, what helps? Oh, quit lines help. So for product development, I'm always mostly inspired, as well as I think that team planners are inspired by simply taking one at a time, looking at that barriers list and saying, is there a tangible good or is there a service that we could develop that would inspire the audience, that would help them do the behavior? And then once we've got a few ideas about it, we test it with them. And in that process, when we're testing it with them, we're able to get down to some of the fine-tuned features of it. So back to the quit line, well, what hours of the day and what days of the week would do, and what kind of content would you want on it? So the concept can come up from the barriers list, and then the specific features being developed can come up from pre-testing with the target audience.
Thank you. Another thing I really liked in yesterday's webinar, and I haven't heard you get into that yet, sort of a quick guide to how to determine which of the three approaches is the best option at any given time.
Okay. Well, let's start with when is education probably the best option. And by best, I'm going to say return on investment, meaning for the amount of resources you're putting out there, the results that you get, the number of people whose behavior that you've changed. I think that education is probably the one to use when there's this situation, when something new has been discovered that, oh my gosh, is when aspirin was connected to children getting Rye syndrome. And it didn't take very long at all before many people stopped giving toddlers an aspirin for things because they found out that it caused Rye syndrome. So when something is new that people didn't know before, when a very valued benefit is there from doing the behavior, and when there aren't many barriers, education is a fantastic option, and it could be used and should be used. The problem is that that's often a small group, especially if there are more barriers to that, and the benefits are not, people don't really worry that they'll get them. So I'm going to skip then back to the law. The law we use when we've got most people doing the behavior. So here in our state in 2002, we had 82% of people wearing their seatbelts, 18% not. All the research with that 18% said the only thing that would make them buckle up every time would be if they thought they would be caught and fined. So we had to have a primary seatbelt law. And knowing that really helped the policymakers realize, okay, yep, we're going to have to do this. But we didn't need that until we were after that final 18%. Before then, we could do a lot of social marketing things, like the little bell in the car that helps people remember to do it. So there are other things that we can do before we get to the law. So the social marketing, I see that as the best option when, if you did a survey among people not doing the behavior, and at the social marketing group, the Help Me group, the people that were open to the behavior, if you ask them, the group, if they're going to do, would they do this behavior, there'd be the people who would say sure, then there are people who say maybe, and then the people who will say no. If that maybe group is the biggest group, that's a sign to look into a social marketing approach. And it's also used when the show-me's are already doing it. The important thing here is that the barriers, once you understand what the barriers are, that those are barriers that we can actually address, and that the benefits that people want from doing the behavior are ones that either prior experience or research shows will happen, like if they do exercise 5 days a week, an hour at a time, that will reduce heart attack. So we need to be able to look and see that there are benefits that we can deliver and promise. And then I think also, especially in this government agent area, we need to know that we've got agencies at the local level, state level, that actually can implement this program, that can design programs and implement them. That's when the social marketing approach would be a good option. And then, of course, when we can think about the return on investment being positive, and when I think when we put resources into a social marketing, if all those other things are there, the barriers can be overcome, the benefits can be provided, and then and it's a large group, I think we will be able to report on a positive return on investment. And we did have some conversation yesterday about return on investment, and if we've got time, we can talk a little bit more about that, Jay.
That was going to be my next question, Nancy.
Okay. So anybody who knows me know I'm a dreamer, and I'm dreaming that we are going to be able to have a database filled with experiences of what did it take for a social marketing campaign to change, what was the cost per behavior change. Imagine that we had a wealth of data on campaigns, whether it be in the environment, health, injury prevention, what it took to change one behavior in terms of dollars. Then what I want us to be able to do is say, what is it costing taxpayers if they don't change that behavior? So that we can be able to report, we can be able to share with the policymaker, well, our experience shows that it costs us $5 to change this behavior, but the taxpayers are actually paying $10 if they don't. So I want us to get to that point. So the necessary data that we need are, we're going to need to know how many behaviors are changed in a given campaign. We're going to need to know how much we spent so that we can get to that cost per behavior change. Then we need some technology people to help us, and scientists help us to determine the cost of not changing that behavior. I believe that we can find this. I don't believe that it's necessarily going to be easy, but I believe that the data exists if we were all committed to getting it.
Okay, great. We have a little bit more time if anyone else has questions. Oh, I see some questions down here just becoming flagged. Eric has asked, is there a model that you can recommend to take our priority segments through the social marketing planning process?
Okay, so the question is there a framework to use? Say that again.
Is there a model that you can recommend? You're asking, Nancy, of course,
yes, I can.
outlines a model for doing exactly that. But that's the question. What do you do?
I have, Phil Kotler and I had developed a 10-step planning model. Started off with 8 steps in the planning process back in 2002, and for the last 3 years we expanded it to be 10 steps. So we have a 10-step planning model, and I'm more than happy to email you an electronic copy of that. And I don't know how I guess if I emailed it to you, Jay, that you could email it to the participants from today? Wynn?
Actually, Wynn has that. Would you take that on, Wynn? That list? I could get it too, but you sent out an email to them when you registered them. So can we just send out to that same list?
He could be on mute.
He could be on mute.
So yes,
I was on mute. I was saying, yes, we certainly can.
Okay, good.
Yeah, it's an electronic Word document, and you'll be able to download that to your Word file, and you'll be able to fill in the blanks, and it takes you through the 10 steps in developing a strategic social marketing plan.
Thank you, Nancy. I think they'll find that helpful.
You bet.
I like it. Question from Lee Pounds. If research is supposed to be generalizable, and social marketing is generally non-generalizable, how do we garner more support for social marketing as evidence-based?
Oh dear. Well, probably more people doing this and putting articles into some of our journals. I mean, I think that's probably one of the best ways, so that when people go to defend some kind of an approach, they can say that there was this academic study that did this and the research showed this. So I think that that's one way. So certainly journal articles, and ISMA keeps a pretty great list of resources for, and there we have now 2 social marketing, is that right? 2 social marketing journals, right, Jay?
That's right.
Yeah.
That I know.
So I guess that's one way. Can you think of any other, Jay? I think you might have an opinion on this one.
I'm sorry, I was doing other things, in the maintenance things in the background on the webinar, so I wasn't.
Well, all I can think of is journal articles and things that we can refer to. I mean, these journals have been around now for one of them for a decade, I believe. So there's got to be resources there on academic studies that have been done. That's what a lot of others do. They do citations of journal articles that have done the research. I also am a big fan, and I apologize if this doesn't address that exactly, but I like to remind people of the concept of Omnibus Studies, where it is expensive to do really reliable surveys, and especially of citizens. But imagine that a state, just like they do for CDC, they do a health survey of 5,000 residents of a state, and then different health departments can then tag along with a specific question they have unique to their geographic area that they could do. So I think these omnibus studies can begin to give us some very quantifiable, reliable research. But I'm not sure that's addressing her question.
And because I was attending to some other things, I didn't hear everything you said, Nancy, but I would like to pipe in that if the barrier is that research can cost so much, that even this idea of marketing, social marketing not being generalizable, that is, every audience will be different. So you do have to do a little bit of research, but often you just have to check and see if the research that's been done before is going to hold for your audience or not. I mean, at the least you can do that. And so there are some lower cost research methods that one can use to see whether you can generalize or in what areas you might run into problem. And then again, I think at the other end, so that's the support going in, and then I think we do need to be careful about our evaluations so that we have, not only for our own programs, but for all the other programs, that there's a lot of evidence in the database that it's working.
Yes, thank you.
And let's make sure that those of us who are not yet members of the Social Marketing Association of North America do become members, because that's how we're going to build up our resource exchange and build up a credibility of social marketing by sharing the information that we have and there, as well as the tools of change, which I'm surprised, Jay, you didn't mention. Jay has the Tools of Change website, which has great case studies on how and why social marketing works.
Over 150 there all have impact results. And actually we've started, when we do our landmark designations for those in the energy and transportation areas, we've started giving them bonus points if they have cost effectiveness information. So there's a good number of case studies that are starting to have that already. Okay. Eric, I'm not sure if you still want another answer. I'm not exactly clear myself about the BEHAVE framework. You're asking you're looking for a model similar to the BEHAVE framework. Nancy certainly offers a model. Did you want to add anything to that, Nancy? I don't know if you're familiar with the BEHAVE framework.
Are we looking at Eric's question there?
Yeah, he'd asked earlier on about, he was the one who asked, do you have a framework for planning? And then he said similar to the BEHAVE framework, and then he says, you may have answered that already.
Okay, and then let's go back to
there's another one. Are there low-cost research methods, non-formal?
Yeah.
For
I'll do that one, and then I'll go to Lori's,
benefits.
okay? Does that sound okay? So so for low-cost research methods, for barriers and benefits, I have done, people who I've done workshops with know my story of in Singapore. I did interviews in restaurants and hotel lobbies and taxi drivers to understand one problem they were having there in Singapore, and just interviewing 10 people, I really got insights. So I believe that we can do a whole lot through some qualitative for barriers and benefits. You can't prioritize them, but after doing 10 interviews and you hear the number one to come up the whole time, then you can feel pretty confident. So I think that there are some ways to do that informally. through one-on-one interviews. The Survey Monkey question that Lori Clark asked was in getting online survey responses from the Nextdoor. We sent it out to 4,000 households that were on Nextdoor. Now that's about half of the population in the city, but and I would never be the last person to say that that was representative. So we don't know that the half of that were on Nextdoor, but among that group we got a 20% response rate. So I do feel like it was fairly representative of that group. And the question being, what is an ideal survey response rate? I really like to be able to say 5%. For some, that's what I've just learned over the last years, that people say, well, I hope you get a 5%, that like at a very ground. But the real deal is to be able to look at the responders versus the list in the first place and to see how different they are. And if they're a lot different, then we have to do some of those weighting techniques, or we have to just present it as qualitative information.
We have one last question. I'm hoping we can fit it in from Sarah Nelson.
Okay.
Any case studies you'd recommend on tobacco cessation and policy changes through social marketing?
Well, any of the states in the cases themselves, any of the states that have the quit line are reporting now on being able to help 2/3 of smokers. And so I actually, in one of our textbooks, we do have one written up on Washington State's quit line. And the rate of return on that was pretty phenomenal in terms of the cost to get somebody to quit versus the cost for taxpayers for a smoker. And so the rate of return was very high. So I believe there's a lot of those. If you also look now, we're at a lot lower for teenagers. That the Truth Campaign and other campaigns from you might try American Legacy Foundation would be able to give some good data on the some cases relative to youth tobacco use and what's worked with that. In terms of policy changes, I think that in states that have the 25-foot rule, where you can't smoke within 25 feet of a door in a public space, I have not seen any good data on it, but I'd be willing to bet that that got some people to quit, but it also got some people to cut down. I'm just guessing.
Thank you, Nancy. We're going to have to move on with that. And thank you to all participants in today's webinar. As you leave the webinar, you'll be offered the opportunity to fill out a short evaluation form, and we really depend on your answers when developing our upcoming webinars. So please let us know what's working and what you'd like us to do differently in the future. Next up, it'll come, there we go, Qualifications and Professional Standards in the Fields of Social Marketing and Behavior Change with Matthew Wood and Philip Holden, both in the United Kingdom. This comes out of an initiative from the European Social Marketing Association where they're saying, how should we distinguish social marketers and behavior change professionals? Can we make use of academic certifications, degrees that are already out there, just require a few more things, add on our stamp through our associations and designate people as professionals in these fields? That's the subject of this webinar. I think you'll find it quite interesting. So please consider joining us January the 31st. Registration is open already on our website. And I don't know why my picture is here, but it's I'll go over to Wynn because I'm just going to say thank you. Thanks to Wynn for helping us make these webinars an important part of ISMA's member offerings. Thank you, Nancy, for the 2 presentations again. Really appreciate it. Wynn, over to you.
Thank you, Jay. It's always a pleasure to be part of the webinars. And you make it seem easy, but I know you spend a great amount of time organizing the program, selecting the speakers, and helping them to get ready for it. And we really do appreciate all the work that you're doing. And Nancy, thanks again for your presentation on social marketing for policymakers, the Help Me approach, or as I call it, selling social marketing. I hope we can have you back for another webinar in our future webinar series, just as we've had you back today. And to our members and our participants in today's webinar, thank you for your continued support and participation. Look, we hope to see you at our next webinar in January. And until then, keep visiting the ISMA website, share your events on our calendar, exchange resources, and also take a look at our Career Center, our job board, thanks to a great work by one of our volunteers, Lonnie Stephens, is looking wonderful. And we're seeing some great social marketing related jobs now on the job board. Make sure if you're an employer to think about advertising. You can advertise for free with us now on the ISMA job board. And if you want to put your resume up, you can do that as well on our job board and Career Center at the ISMA. Until then, this is the International Social Marketing Association. We now conclude today's webinar.